Hi YouTube. My name is Jerry, and I decided to record this video today. I had a distal biceps tear repaired a little less than 24 hours ago. Yesterday morning at 10:30, they wheeled me into the operating room, and I guess I wanted to make this video because leading up to my procedure, knowing that it was going to come to this, I did a lot of research, looked at a lot of YouTube videos, and it seemed like probably greater than 90%. In fact, I never found a video out there that dealt with a partial tear that they did the repair. Most of them out there are complete rupture. And so I thought once this procedure was done, I would make a video. Maybe it'll help somebody that has a partial tear that between their surgeon and themselves, they decide to do the distal biceps repair as opposed to letting it go, perhaps. I don't know. I don't know how this is going to help anybody, but I'll just tell you my story, and I'm going to put it out there for everybody to see it, and they can make up their own mind. But so mine was a partial, quite a little bit of pain involved with that. I went in and had an x-ray, of course, first, and then they did call out for an MRI, which I had the MRI done probably a month and a half ago. My surgeon, then told me the results of the MRI showed that the right bicep distal head had torn away from the radius greater than 50%, slightly greater than 50% was torn off the bone down here. And he said it's not so much a matter of if, but when it would go completely. So he said you either leave it go or you do the surgery. And he said you got to be willing to put in the time. Unfortunately, this is going to take from what they tell me, somewhere around 4 months to totally recover from this. So mine, basically I went into the hospital yesterday morning. They talked about a nerve block, which I elected to do. And I think I'm going to be glad that I did that. They turn your head completely this way, and they look for the brachial artery and the brachial nerve bundle that runs just behind it. And above the collarbone, they deaden the area and insert a needle and get down close to that brachial nerve bundle that runs down your arm. They bathe that nerve bundle with anesthesia. With that anesthesia, then deadens everything from, I had a lot of numbness and deadening in the neck and all the way down to the fingers. Overnight, that did go away for the most part. They said it would be 18 to 30 hours of numbness. And then, of course, they still put you completely out for the surgery, but that's just to help get ahead of your pain level that you'll have post-op. So anyways, they did that, and about an hour later I was getting wheeled into the surgery room where they did completely put me under. So this procedure that I had done was not an endo button procedure. A lot of them that you'll look at on YouTube, doctors out there doing an endo button. which I guess they have quite a bit of success with. My surgeon, for whatever reason, didn't like that procedure. He has his own reasons, I guess. But what they did is they did a incision in here on the top of the arm, about 2 inches long, and then another incision on the bottom of the arm, roughly 2 inches long. They go in and clear that area all open and get a good visual of the distal biceps tendon and its attachment or lack of attachment to the radius. They grab it in some fashion and basically finish the job by slicing it completely off the radius and then hold it. They take a grinding tool of some kind and grind an area on the radius, suture through the tendon after they clean it up. They suture through the tendon up one side, across, and back down the other side, leaving 2 tails of suture. Then they drill 2 small holes through the radius and pass the suture through the holes all the way to the other side, where they pull the sutures to bring the tendon head down to that roughed up area on the bone, and then tie it off down here and close you up. So I really don't have any pain. They did give me some pain medication. They said take it right away as soon as you get it, to get ahead of the nerve block wearing off, which I did as recommended every 4 hours. And through the night, I slept pretty good. We ate a good meal last night before I went to bed, and I slept pretty good, and really didn't have anything other than this annoying tingling in these 2 fingers of my thumb, which I absolutely couldn't stand, but it was there for its own reasons. So now that is starting to go away. It's been almost 24 hours since they did the nerve block. And I've been drinking a lot of water, which they say will help later. The medication does things to you. They say the water will help that. So I've been drinking a lot of water, and like I said, I slept pretty good. Every 4 hours waking up to do my pain medication. And I did sleep in a chair, kind of upright, because with that nerve block, it sort of affects your diaphragm. So when I laid down, I felt like I had a weight on my chest, and it was hard to breathe. So I slept in a chair, my lazy boy. But, things along that line. So in about 10 days, 9 to 10 days, I go back to see the surgeon for post-op, where, if I recall, they're going to take the sling off at that point, and they're going to rewrap with the bracing that has the dial on the side of the elbow, where they can basically set to where you can't go out past 90, but at that time he's going to allow me to bring my arm up a little bit here and there to kind of get movement back into this limb. And that'll be 2 weeks that way, and then I go in and they adjust it to 45, which will allow me to have my arm at 45 degrees, and I can work it up for 2 weeks, and then after that, I guess they allow it to go straight. So I just wanted to briefly touch base today. Hopefully this video will help someone out there. Of course, all decisions are between you and your surgeon, but I feel as of right now I have really no pain, just this annoying tingling, and Spirits are high. I think everything, and I'm hopeful everything will go well in the coming weeks. Maybe when I get to my limitation brace, I'll do another short video to let you know how the past 10 days have gone, and maybe the outlook for the future. And I'll let you know as time goes on. I may make a couple more videos just to kind of lead you along and help you with, if you're looking at having the same procedure. But like I said, my procedure was done and it was completely different from what I've researched on YouTube. Most of those were a complete rupture where it comes clean off the bone and your bicep rolls up into your arm. This one was had some deformity, I guess, but not that I could tell, I guess. And I chose to be a little more proactive and get ahead of that, because then the incision would have had to been much longer to possibly reach that tendon and bring it back down. So anyways, in closing, like I said, everything is okay. I feel good. My spirits are high. I'm very optimistic, and I had a good surgeon and a good team. I feel like they took care of me. They explained everything really well. There was no surprises. So with all that, I guess I'll let you go, and I'll check in a couple weeks and let you know how things are going. All right, YouTube, thanks.